Today we're here to talk about what we can achieve together across South West London. We all can take responsibility for leading change, and that is what today is about, is encouraging and empowering leadership across our system in whatever role we have.
We've been planning this conference for some time. What we really wanted to do was to bring so many groups of people from South West London together. Conversations we've had today really are about collaboration, they're about big audacious goals, they're about ambition. We really want to get all the people who are involved in delivering health and social care together, because we want to do the best by choosing some really important priorities for the people of South West London.
We have been trying to create an opportunity such as this to bring together leaders from all different disciplines, clinically motivated to help try and shape and focus the efforts for South West London. So it's great to see this come to fruition today, and actually the room was packed.
Increasingly, the issues that the NHS are trying to deal with require an integrative and collaborative approach. So I think it's important that local government and the health services work together, and that we understand where each other are coming from, some of the pressures and challenges we each face, and what we might be able to do to work together to address those challenges.
Putting patients at the centre of service change is really important, and that's what Healthwatch is all about. It's great to see so much energy in the room, so many people who come from across the NHS.
Everybody really wants to see a change to how we manage end of life, and a real emphasis on helping people plan and think about what a good end of life would be for them, and what a good end of life would be for their nearest and dearest and the people who are caring for them.
It's not just about the service delivery in the last years of life. It's actually, we need to have a culture and society where we can plan and discuss and everyone feels comfortable about this.
I attended the mental health focus group. We've had some very good discussions about why we think people attend A&E for their mental health crises, or what is happening in our community services as to why people are breaking down when they're under care.
The mental health focus group is really important, from pregnant women right to care of the elderly. Every care group may be affected by mental health, and there was lots of innovation and good practice that were talked about.
What I'd really like to see is if we can start breaking down those borders between general practice and hospitals. It's not enormously satisfactory from a patient point of view, and so designing something which is far less tiered, far less separated, would be far more beneficial for them.
So I went to the respiratory group. I felt that allied health professionals and nurses could really help to try and address some of the critical challenges that doctors are having with trying to keep on top of the workload, ongoing management and support, and really trying to improve quality of life for these patients.
So many of the things that we want to talk about today, hypertension and atrial fibrillation, they need to be accompanied by really good lifestyle choices so that we can make patient care as good as it can be.
I'm a diabetes consultant. I work in our local area in Wandsworth, and I think this conference has got real power to make some changes to improve diabetes care for our patients in this region.
Primary care networks are going to be evolving, and I think they're going to be the centre of this transformation and this change. I think there's lots of opportunities for primary care networks to link in both into secondary care, but also back out into local authority, the wider public sector, and indeed the voluntary sector. And I think that's where we're going to see a lot of value added in years to come.
What we need to do now is use this opportunity, bringing people together, use it as a real call to arms for people to work together to make sure that the really brilliant examples that we've seen in bits of South West London are available to everyone in South West London.
If we continue to work collaboratively, there are so many health outcomes that we can potentially improve that I think we're clearly going to have to prioritise what's important for the population of South West London. But we've got such enormous potential and enthusiasm that I'm coming away from today very excited about what the future holds.
Put the patient in the centre, and then us, health and social care as providers, begin to ask the question, what do we bring to this individual?
I think the relationships we're building are really important, because that will help us to get stuff done. And I want people to go away with a real sense of ownership of the priorities we set, because then we'll see them delivered. I want to come up with some priorities, because if we try and do too much at South West London, it just won't happen. We know if we focus on things that really matter to patients and our organisations, and really harness all our energy on those, we're likely to achieve meaningful change.